and welcome everyone for today's English session. Today is our 1827th day of continuous webinar. Thank you all the participants for joining with us. Today's our guest is Dr. RAMABHAI AMBARAM Patel, and he's MD in Homeopathy and Director and Principal and Hospital Superintendent and former head of the Department of Surgery. He worked in surgery department for 11 years. He was a principal in the college for 11 years in Vadodara, Gujarat, and he presented papers in many national and international seminars, and he visited many countries like UK, US, Dubai, and presented papers, and visited Germany for research purpose. And he had conducted teachers orientation for CCH Gwalior and Kolkata and Amaravati and many places. And we are so glad that you are taking class for today's session. Thank you and welcome, Dr. Patel. You are the co-host, right? Okay. Okay, you can start, sir. Thank you. You're welcome.
Are you able to... Am I audible, sir?
Yes, yes, audible.
Okay. Can I switch over my topic?
Yeah.
Now, let me first introduce the very theme of my lecture. My lectures are slightly different from the routine one because it is more concerned with the research on literacy research base. And I have delivered almost 6 to 7 lectures on literacy research. I am a person who has passed Ayurveda as well as homeopathy. And since last 20 years, I'm searching the reason, the cause, the secrets of evolution of homeopathy, and have found out much more. And I have tried to contact to the authorities at level of India, but I think they have not heard it, or nobody has shown the interest. Even now, I continue this. My topic is a comparison. I have presented comparison, mathematical comparison. Before that, I have presented the comparison of the metal origin of the medicines of Ayurveda and homeopathy. Now, this time I am presenting the herbal medicine. So, why to compare? The very aim is what I have found out, that there is some secrets lying behind the origin of homeopathy, that there is a close connection between homeopathy and Ayurveda, whatever the case may be. And when we go for action, homeopathy, Ayurveda was prevailing for centuries together. Homeopathy is a recent one. But there are some common things in both the systems. They are using the crude material, highly combination of 10, 20, more than 20, but still it is working. And we are using only single dynamic form. Still we are claiming, and there are many way of prescription. It is immaterial now. It is out of it. I will describe it. But I want to find out, or somebody has to see into this. Okay, a person who claims that I have taken Ayurveda, I was better, now it has started again, but I am not able to go to visit my doctor, so I have come to you. And the medicine which you have given also has relieved me as good as which I was taking with Ayurvedic doctor. Then there are, disease is the same, problem is the same, two different systems, and results are similar. So there is some similarity. As we say, similia similibus curantur, they say similar treats similar. They say similar attract similar. So we are based on proving. Where was not there proving because there were no laboratories, but still for 1,000 centuries, their work is also going on. And especially in Kerala, it is much more prevalent than any other part. Uh, so when proving was there, the question is, it was the herb which was taken from Germany, grown in Germany, and there were no pathological studies available there that time. So whatever symptoms collected, they are given to us and we are using it. But pharmacy has developed now. Pharmacy says that phytochemistry means minimum content of any herb will differ from place to place, even from country to country. So whatever herbs are prepared in whatever herbs are used in India, they are also prepared. They grow up in the land of India, so they are definitely different. So is there new proving is required? So that's why we want to compare whatever is available in medicine which are grown in India and whatever medicine prepared from Indian herbs in homeopathy. So there is a similarity, and it refers back a lot, so many years. Now my aim is something different. Though this is the subject quite away from the normal which is going on in Indian, especially in the webinar section, that somebody should come forward, because if I die after a few years, the new system will vanish if nobody is taking interest or taking up the matter to the high level, because I am tired and exhausted. So I am feeling that there is some integration or some similarity not only in homeopathy and Ayurveda, but also in allopathy and pharmacy. I have pharmacy college in my campus, and I have seen the syllabus. I have seen their laboratories. And allopathy also, there are so many products. For an example, 1 gram weighing tablet is there, and the contents are 5 milligram. So it makes 1:10. So there is some similarity. That's why I am running on the carrying out this. I am going to present around 20 drugs today, but I am ready to present more drugs if the IFPH permits me. There were so many symptoms, but because of shortage of time, I have not been able to present it here. The bibliography includes in homeopathy this time only few authors. That is William Borick and C. Herrings and E.B. Nash, J.T. Kent and J.H. with volume 1, 2, 3 on Ayurvedic side. Nadkarni, which is a renowned person. Vanavsati Chandrodaya in 10 parts. Then experimental, William Lewis. It is something different. I don't want to discuss, but I'm sure that William Lewis is on the base of origin of the homeopathy. And Priyavar Sharma, author of 4 parts of the Ayurvedic Materia Medica, and some of the quotations I have brought down from the network where the material was not available, sufficient material was not available in the books. So here we start with the very first drug. What I am finding difficulty, only I am able to see only my host. But what about the other person joining? Can you open it up somewhere? If, is it?
Yeah, others, those who can please open the camera, please.
Okay,
Otherwise,
please open the cameras. I will start speaking
yeah,
because time
otherwise,
will run out. Already it is 8:38, 8 minutes have gone. Now, almost all the herbal drugs are available in Ayurveda, from which the homeopathy has prepared the medicines. Now you can see the aconite napellus. There are comparison, and I have given the reference of the author. But please excuse me, this time I have not been able to exactly point out the page and the paragraph because of the shortage of time. But definitely the page number is there. If you try to enter in and hunt for the word, you will definitely go to that place. So aconite is a drug which travels through nerves, it is said in the Ayurveda. The very site of the sora is the aconite, and nerve is the seat of the aconite. So you can see the number of the symptoms. Numbness, tingling, neuralgia, restlessness, paresthesia, affinity to nervous system, affinity. The horse for the aconite to travel, or a horse for the aconite to travel is the nerve system. In Ayurveda, something is written in a different way, but I have just simplified and put it here. The palpitation, functional changes are noticed in, see, functional word is used. Aconite initially start with functional changes, and when functional changes are prolonged, not countered, not relieved, then the pathology starts. So anxiety, sudden fever, and that too more related to the characteristic symptom of the aconite, that is fear. Then fear of any cause with characteristic symptom. Now, dryness is the character of sora. Pleuritis is a secondary to the prolonged continuity. Then enuresis, loss of neural control. Cystitis, loss of neural control. Rheumatism and sciatic, here also rheumatism and sciatica means both are nervous origin. Enteritis, no issue with the wall or the content of the bowel, but issue with the nerve supply of the intestine. Next drug is Nakswamika. Nakswamika is what I personally feel that it is belonging to the area of sympatho-parasympathetic secretory and nerves. So normally any homeopath, when he comes with the constipation, his mind goes to the Nakswamika. If he has not taken case properly or thoroughly, straight away, that is called the what we call general practice, GP, homeopathic GP. But here you can see the symptoms. The tonic in a small dose. Now this sentence will be repeated in another drugs in Ayurveda, and it is surprising that in Ayurveda why it is written so that a small dose is strengthening, large dose will be complicating. Small and large, they have not mentioned the quantity. Doesn't that refer to the dynamic condition of the homeopathic medicine? Or I think it has been taken, that word is been migrated from Ayurveda to homeopathy to make it more and more dilute. Now, the symptoms are restlessness, exaggerate sensitivity, great nervous excitement. Here, produces the sleeplessness. Here there is a why there should be so many leading symptoms comparable which are available in Ayurvedic drug. Means there is some platform is there from where Ayurvedic material is taken into consideration while proving the homeopathy. That is what I say. I don't say it is copied from Ayurveda. Now, tiredness, that is weakness. And here you say visual power reduced due to optic nerve atrophy. See, nerve atrophy. Here ultimately it has come to the nerve. Elementary. Now it has got another area of elementary, total. That is weakness, loss of appetite, colic, eructation, flatters, heartburn, means acidity. Then now go down, constipation followed by hemorrhoids. Then when constipation is relieved, it may convert into the dysentery. Here you can see two contrary things are available in the similar drugs. How it is possible? We claim that it cures one thing. So it can cure dysentery, it can cure constipation. Means we have to look somewhere in other areas for prescription. Dyspepsia, pain abdomen. Now third area is a urinary and reproductive. So spasm, here is a bedwetting, here is a frequent passing urine. Paralysis. Paralysis is indicating to the sphincteral paralysis. Means nerves control which is closing the sphincters or opening the sphincter is disturbed or it is lost. So there is a paralysis of the sphincter. So it is in the field of nervous system only. Now, when nerve is again weakened or excited, there is an emission. There is impotence. When it is totally weakened, there is impotence. When it goes to respiratory area, it causes the cough. Here is the asthma. Both sides there is asthma. Now, Naxomica and asthma, how can we prove that the asthma belongs to Naxomica? Bronchitis means it is a secretomotor. The pathological purview of the Nux vomica is a secretomotor medicine, which controls the secrets of the lining membrane of the hollow organ. Gut inflammation, it is a very far away from this is a very late stage of the Nux vomica. Now next drug will take belladonna. Belladonna, those symptoms are there, you can compare. I will put it on the Facebook. I will pass it on to Dr. Sir to Patna. He will put it on. But without wasting time, I would like to say in a nutshell that belladonna has something inflammatory only, and color has to be red. What was taught by my teacher, that once the color changes from red to coffee ground, there is no room for the belladonna. Now, where is the asthma and belladonna? Belladonna is a bloody remedy and asthma is a respiratory thing. But when there is something which has started from the characteristic of belladonna and the same patient has converted into asthmatic condition. So on the background, there is a belladonna. That's why we call. Normally, when we talk about asthma, we talk about anti-asthmatic drug, Justicia, Adatoda and all. Now, neuralgias and polyuria. But they are all, neuralgia is not nerve. Neuralgia is the belladonna nerve, blood supply to nerve is disturbed. That causes the neuralgia. And polyuria means the urinary bladder is full of congestion. Means ultimately when we talk about any symptoms, and we want to prove it belladonna, we have to go through the pathological progress of the individual. And that's why in homeopathy, one base thing is there, that is a deep case taking, prolonged case taking. Same way, belladonna and fever are just neighbor. They are complementary to each other. Spasm is due to the congestion. Glandular swelling, swelling with redness. Dryness. Now, belladonna has got very leading symptom of dryness. Atropa, belladonna. And atropine injection is used by anesthetists to reduce the secretion of the throat during operation so that it doesn't disturb or doesn't cause the pleuritis when the operation is over. That is what atropa belladonna. The word is used always atropa belladonna. And fever, spasm, glandular swelling and all are included into the belladonna. Now, opium is quite a different drug from all three. Opium is weak. I call personally opium as a war drug because it was used during wartime. And the warriors, they used to take the opium, they used to apply the opium on their body, and they went into the hallucination so that they don't have any fear. The world is open and their strength is increased multifold by taking So the very picture of the opium is first is accelerates the power till such the opium is available in sufficient quantity in the body, especially it is traveling through the nerves, through the lining membranes. Not now, it is traveling through lining membrane. And then when the power is exhausted, then it declines. That's why to again repower, again he takes the opium. So likewise, opium addicts were produced in previous era, and when they were retired from the warriors or the Fauj, they used to suffer from all the symptoms which are shown here because of the withdrawal of the. Then they have to take the opium to reduce that. Not only this, there are we in homeopathy also there are two, three, four more addicting drugs, and the picture is the same. So analgesic, you cut the by sword also they don't feel that I have been cut. That's why they used to use the opium. Now various symptoms are there according to the amount of the drugs which the patient has taken. Finally, when there is a decline, he is not able to meet. Even he is not able to meet the demand. Suppose you are taking 10 grains, now it has gone to 20 grain, even 20 grain to 30 grains. But 30 grain is also not stimulating him. Finally, the organ starts collapsing, failure. In our ICU, we call organ failure, but it is exhaustive on the base of exhaustion. They are not able to pick up the. So there is a finally here it is written. There is a depression. There is a weakness. Withdrawal causes the paralysis, including the respiratory paralysis. The symptoms here are matching. There is a colic, there is a gastric disturbance, slowness. Everything goes slow, and finally he dies of the paralysis of the respiratory tract. Now there are three large drugs, polycust. Now I will give the indications of the another small drug, asafoetida. Asafoetida actually it is a kitchen drug. And it is central idea of the asafoetida is only and only digestion. Digestion causes the burning, digestion causes the constipation, digestion causes the flatus, digestion causes the taste disturbance, and then may be a colicky, there may be abdominal pain. So here both side similar symptoms are there, and it is in India maximum use. And in Ayurveda, there are so many combinations available where the asafoetida is included in the formulation. So here, there is one complaint of asthmatic attacks. Why should there be an asthmatic attack in asafoetida? If miasm, I don't know whether you agree with me or not, listener, gentlemen, but asafoetida is a soric drug, partially more soric and less syphilitic. And asthma is a soric disease, as per my opinion, as compared to the miasms of the Ayurveda. So that's why when there is a dryness, when there is a lot of flatus and the whole stomach is pressing the diaphragm is pressing the lungs, and so ultimately lungs suffer from the asthmatic attack. That is what here I am explaining, but there are symptoms together. The here asafoetida in Ayurveda is called anti-asthmatic. Here in homeopathy, we consider asthma as a symptom. Hysterical attack of asthma, the short breathness. Likewise, so many comparable symptoms are there, but in spite of that, I felt that there is something missing. So I refer to the scholarly articles. And there is a link provided. Asafoetida is considered to be a neuroprotective, memory enhancing, anti-hypotensive, anti-obesity clinic, and anti-cancer also. And I think they may be correct when it is used holistically or judiciously, definitely it will do its work. That is what they want to say. Now, next drug is a beriberi. Beriberi is another sided drug where story is there why beriberi is used as a drug for blood purification or for to throw out the content of the urine stone. That is it is told in the classroom. I don't want to refer it here, but you can see the beriberi urinary, especially it is concerned to the urinary system. I don't know whether my friends will agree with me, but beriberi can be given irrespective of the respiratory tract in any chronic patient, because patient suffering from chronic conditions, for any suffering, in his tissue and the blood, there will be toxic molecules. Beriberi has got the power to find out those toxic molecules and throw it through the kidney. So it is something not remarked anywhere, but it is my personal view. Hematuria, renal colic and all common. When beriberi, even rheumatism. Now, what is rheumatism? What I said, in rheumatism, there is a collection. And beriberi has got the power to suck it out and throw it through the urinary tract. So, rheumatism is included in that. But initially, there has to be some renal issue with the patient. Catarrh, loss of appetite, and all are common. Both the side symptoms are similar. But here you can see William Boric is a mathematical used by almost all the students of the world, especially in India. When he enters, he is given William Boric. But you can see the William Boric, there are some peculiarity. It is accepted because of its formulation. In beriberi, he has mentioned seeds power 10 grain TDS. Seeds powder. Now, is this homeopathic? Also, mother tincture. We consider mother tincture as a dynamic medicine. Do we? I don't know. When beriberi is used in an enlarged spleen, gallbladder catarrh, see, it has ultimately gone to syphilitic miasm, syphilitic area. And gallbladder is the base organ where syphilitic is traveling, syphilis is traveling. So here, beriberi is a drug specially for urinary tract and its related symptoms. Now another drug very commonly used in the market, especially nucleoside and all, when female go for purchasing the vegetables, they carry the bathua. They use the bathua, means Cyanopodium. Cyanopodium anthelminetics. It is very understood clearly that anthelminetic means anti-worm. It is, whenever we talk about worms, we remind Cyanopodium, there are 2-3 more drugs. So you can see oil is used here also. In the William Boric, it is mentioned oil is used. So whether he is copied from here or whether it is homeopathic or not, it makes a doubt. And especially roundworms. It is used deworming. In a scholarly article, it has been mentioned. Now, when we talk about other things, but in Cyanopodium, there is one specific mention, and most of the homeopaths I have consulted for my cases, especially tinnitus, and when they say that hearing now is dying out, so my deafness is increasing. So there they talk about the Cyanopodium. Cyanopodium by scholarly articles and by researchers, Ayurveda also had made a research, very gigantic research on this. And they have said no research is supporting the cyanopodium will improve the auditory nerve condition. So whether, and I have used it in many patients, I have not found any result. Almost all the potencies. But in Ayurveda, it has been mentioned, the scholarly research, it has been mentioned that it strengthens the nerves. So in homeopathy, it has been taken as a, when it weakens the nerve or auditory nerve is weakened, that statement is applied there in the homeopathic form. Scholarly articles, the cheapest and most readily available source of important vitamins, mineral fibers, and essential amino acids. It has high functional potential and basic nutritional benefits. The plant is used in diet not only to provide minerals, fibers, vitamins, and essential fatty acids, but also enhances the, see what I told you, but also enhances the sensory and functional value of the food. Means it gives the strength to the sensory nerves, but it doesn't, when it is given in the form of homeopathy, it doesn't improve. That is what has been claimed. And why I have mentioned this? Because cyanopodium has got a very little investigation or the proving, and area is very small. But if the article says they have proved it, then they have written it. So why not we can go whenever any cyanopodium by any authority is being researched, is being reproved, then take this condition, this statement into the consideration and look for its applicability. Next drug is jamun, Cephalandra indica. Cephalandra indica is the name given to the seed of Syzygium gembolinum. Both are same thing, but sometimes the Syzygium gembolinum is given, pulp also is used, and in some cases only dried seeds are macerated and powder is used for preparing homeopathic drug or for giving it to the diabetic person. In Ayurveda, direct powder is given. Now, can there be any secret? We are dynamizing, they are giving in a powder form, and both of us are having the good result. So what is the central idea? How there is some secret, and Dr. Hahnemann knew this secret. And based on that, he has invented the homeopathy. But the secret is not declarable. Now, there are some things, seeds powder, glycosuria, and when the diabetes goes more beyond the limit, then it causes the skin affections on the back side especially. But in homeopathy, we have given a name to the prickly heat-like appearance or prickly heat-like sensation. But ultimately, it is a diabetic dermatology. Now, you can see the scholarly article of Jamun or this, they indicate more and more areas which are left in any of our mathematica, if they are deficient, research is deficient. So person who is looking for that, he can go for these symptoms, and there are plenty symptoms directly or indirectly working. The Syzygium is working on that. And it is said that it is anti-edematous, anti-allergic, anti-inflammatory, radioprotective, gastroprotective, anti-hyperlipidemic, anti-cervical cancer, cardioprotective, and diuretic. There are so many more symptoms. I don't want to waste the time on that. You can refer it when it comes on the Facebook. Another drug, chamomilla. When we called, there is one sentence used when the teachers start talking about chamomilla in the classroom. Calmness is contraindicated in chamomilla. So, patient or child suffering from vomiting or flatus or dentition problem or the stomach issue. Even it is used in rheumatism. What is the mechanism of rheumatism of chamomilla? We have to understand. See, pathology is one, area is one, two different therapies are acting over that and bringing the similar result. Somebody says, my ulcers were treated by chamomilla. Somebody will say, my ulcers were treated by Ayurvedic Marticaria, powder form. Then where lies the dynamicity or the crude condition of the drug? And scholarly article includes about this, it includes the use in diarrhea, common cold, anxiety, insomnia, colicky pain, menstrual pain, ADHD symptoms, motion sickness, and fibromyalgia. These are the additional area which they have mentioned. We can go ahead for research. In Cinchona officinalis, Cinchona is the father, we can call, from which the homeopathy has emerged. China. There is a long story of China, but here you can see they have also maximum detail of the Cinchona in Ayurveda, because Cinchona has traveled almost 6 to 7 countries before it reached to the India. And Cinchona was used as a kitchen material, as a addictive, as a stimulant in Peru, in other Western countries. So here you can see antibiotic plus rigor, antibiotic with typhoid, rigors, night sweat, and it is anti-periodical. And anti-periodical, in Ayurveda it is written, in homeopathy it is written great antibiotic for the typhoid. Means typhoid is a periodical. Now periodicity is marked in China, here also periodicity is marked. How they have come to know that it is periodic? Actually, periodicity word was used maximum in Ayurveda. It has later on come in homeopathy. That is called, there are 4 types of fevers, and very good description is given in Ayurvedic. Here only we know about the fever with rigor, especially considered to be a malarial. Now, symptoms are like a collapse, debility, tonic. Here it is given tonic, and here it is used debility. Tonicity is a vigor, and debility is a loss of vigor. We always are pointing out the symptoms which are related to against Ayurvedic terminology. So where there is a strength, there we call it paralysis. So here delirium, again some words are there with both the similar. Delirium. Then there is a tincture impaired cardiac activities. Here impairs the circulation. Here it is written tincture impairs the cardiac activities. Here it impairs the cardiac circulation. How far it is, when it is proved, who has proved, but it is written by JH in part 1, page number 477. It is there. I have not used any word from my heart or from my mind. Whatever is written in book have been mentioned here. Now uterus, see, it excess dose induces the labor pain and causes the abortion. So China can be used as a abortifacient. They proved it. Against that, we can strengthen the labor. Then it is a trimiasmatic. Here, the chronicity means trimiasmatic. The joints are included, the uterus included. Lochia in postpartum fever, that is Sutika Jwar. Here, lochia is one of the symptoms in the China. Conversions. Then here we see blindness. where the blindness is to be related to the. Here, there is a blindness, there is a deafness in Nadkarni part 1, 315 page. Here, GH part 1, 477 page. So, there is some similarity, definitely. So, why should not we make use of this similarity, from where it has come and what is the value of those similarity when we consider, when we prescribe our drug? Proton, only one line, proton in our eyes. When we talk about proton, diarrhea, stomach pain, because it is castor, something like a elder brother of the castor, croton. So it will cause only pain, pain and pain, diarrhea, diarrhea and diarrhea. Person who is suffering from stubborn constipation is given croton. So he loses the stools and there is a dysentery. So, but here other symptoms include asthmatic condition, convulsive cough, summer diarrhea. It is a powerful purgative, and it was used in a ethno or a mythological word to weaken a person. The croton was given, like when they go for fighting wrestlers, the opponent was somehow directly or indirectly croton was given. That's why there is a neuralgia, swelling, rheumatism and paralytic condition. Because paralysis is not direct one, it is an indirect. When he loses a lot of stools, whole body is drained out, may suffer from paralysis. But here also there is a condition called paralysis. Vertigo, laryngitis, eruption, like a herpes zoster. We use it in herpes zoster and there are results. Here also skin inflamed, skin papules and pustules, and there is a irritation on the skin. Means almost similar. Another drug like a aconite, but is slightly different from Helleborus niger. Here also Helleborus niger, they were also using it, but very little material is available on the Helleborus niger in both the system. I don't know why. There are so many symptoms not found, and I have left many symptoms unmatched because of the shortage of time. I will continue to match it and reproduce it again. But when we call a Helleborus, there is a one sentence connected with Dr. Hahnemann. When he got his degree, the title of his dissertation was Helleborism in Ancients. And one secret, let me put it on in public. When he appeared for his degree on 10th April, the judge's bench included one of his elder son was judge. There is epilepsy, convulsion, dropsies. Here is a dropsy. Then vomiting. When a overdose, there is a vomiting. Diarrhea. Helleborus can cause the diarrhea. Purging. When diarrhea, purging are correlated. Scanty urine. Now, what can be the pathology behind the Helleborus? But there is a scanty urine. It can, the reason is not known, but it has power to suppress. Helleborus suppresses the IQ, the presence of mind, and it can cause the hallucination. So there is a chill. Here is a cold. Dr. Hahnemann called it a Helleborism of the ancient. Page 490, part 1, GH. Page 490, part 1, 878 page number. Now next is the stramonium, same group. Helleborus and stramonium belongs to hyoscyamus also. They are all three one and same with a little difference, but symptoms are almost connected to cerebellum, cerebrum, spinal cord and large nerves, including the spinal fluids. So cerebral affections with drowsiness, delirium, vomiting, pain at zygomatic bone. That is indirectly, zygomatic bone indirectly, it is a trigeminal neuralgic pain. And it causes the insanity. Persistent mental disorders will be there in insane person. Asthmatic symptom also may be there, but it is a provoked directly. It has not been related to asthma, but provoked, and fever. Then later on, adatoda. When we talk about adatoda vasaka, justicia adatoda, only in our mind is the breathlessness asthma. That's all. And it is definite. There is nothing much given in both the books about the justicia adatoda other than the respiratory condition. Another drug is a turmeric, curcuma longa. It is a medicine working only in kitchen and used in India, and the symptomatology is almost common. You can see the list of symptoms: antifungal, anti-arthritic, carminative, anti-jaundictic, dry cough, catral, diuretic, sexual passion diminish, vertigo. Here sexual passion is diminishing, and here it is a spermatoriac. Then flatulence. Likewise, there is a list of the symptoms. Now next is the crocus sativa, which is used for used for giving a smell, good smell to some preparations, and also it is considered to be something which enhance the vitality indirectly. But problem with homeopathy and is that in Ayurveda there are 3-tier system of health maintenance. In homeopathy there is only 1-tier system of health maintenance. That is, when bad health is there, take homeopathy, rectify it. In Ayurveda, for bad health there are drugs. Even there is no complaint, but to maintain the same health there are drugs. And to enhance the health, to continue longevity of the life, people used to live for 100, 150, 200, 300 years. So that is not available in homeopathy. That is the difference. So here, when we talk about the crocus sativa, it includes only vitality. And in children, they used to give a small piece of crocus when they used to continuously cry, considering that child has the stomach pain. In previous days, nowadays hardly anybody uses that. Hydrocortisone asiatica, khad brahmi, both the side similar symptoms, and especially I consider this is the medicine at par for psoriatic symptom, and almost all symptoms are related to psoriasis. You can see both are lactation, orchitis, then impotence, female ovarian irritation, female degenerative organs are affected. There is a asthma, there is a asthma. Both have the paid name and all available there. Mentha is another psoric medicine, and it always travels upward. So when anything travels upward, any miasm travels upward, it passes through the lungs, and when lungs are put into the pressure, it causes the asthma. So mentha is medicine for asthma, pain, stertorous breathing, whooping cough, dry cough and all. And it is but natural. Even that some Vicks is kept in our pocket is nothing but asthma. Mentha. It is a very good drug for many conditions, directly or indirectly related. For an example, gastric dynia. It will increase the power of, it will increase the contractile power of these sensory nerves, and to put the muscles under the work. The flatulence, bilious condition, herpes zoster, headache, rheumatism. Here is a rheumatism, pruritus. There is a pruritus. Now, where pruritus? How pruritus can be related to the mentha? But so there is a we have to establish some philosophical description. We are simply teaching because the Hahnemann doctor has given something and we are just using it. There are scopes of PhD topics in homeopathy, because when I referred 4-5 Mathematica, there are ditto sentences, ditto symptoms, ditto quotations. Why should it be there? One author is there, another author is there, another doctor is there. He claims that I am a homeopath, I have proved so many drugs. When he writes about the Helleborus niger, all are having one common quotation. So we can make one topic that is a similarity or similar symptoms available in various Mathematica. Then gingiva offensialis is also a common drug which is used in the kitchen. But Ayurveda, these are the drugs used as a very nice to prepare medicines which will be very effective, but in a moderate condition, not advanced condition. These we do not use. Symptomatic condition, mentha is also working more on symptomatic. Gingiva is working more on symptomatic. You can see dyspepsia, acidity, windful, weak digestion, intestinal catarrh, diarrhea, urethritis, and dropping after the urination, weak respiration, asthma aggravated in the morning. We are having aggravation and amelioration, but in Ayurveda also, there is a seasonal remarks, and there are aggravation that like this they call first grade drug of heat, second grade drug of the cold. Likewise, there are references. So maybe these references have been migrated here. Now, last drug is the coriander, that is dhania, and it has got lot of. That's why in India we are using so many primary herbs when we prepare our food, and also in kitchen there are so many condiments are used which keeps the disease away from body. Only the bad habits are responsible for creating the more diseases. Now, for coriander, I got only stomach related symptoms from both the books. But when I refer to scholarly articles, especially the ResearchGate, which is a there are 3-4 medical websites which have lot of material. You can say 50-50 articles are there on a small things. In addition to that, it is antioxidant, anti-diabetic, diuretic, insecticidal, cell reinforcement. Now, what does that mean? Cell reinforcement. We have to go and refer in the deeper part of that, or ask that person who has posted it in the website. The menstrual disorders, analgesic property, rheumatoid arthritic properties, inflammation of the liver, erythema, and even toxicity. It keeps away the toxicity. It is anti-hypertensive. Maybe when we were using these things lavishly, regularly, I think health standard of the Indians were very within the normal limits. But since we have left it, the kitchen and started taking outside food, the benefits of those drugs or those herbs, we have lost it. Now, another one is the Soralia. Soralia is again like a hydrocortyl, Sorainum. We call Sorainum.
Dr. Patel.
Sir.
Now we have only 3 minutes.
Okay, it is the last finish.
Okay, thanks.
This is over. Now,
Okay.
Soralia had got another area of cardiotonicity, vascular dilation, pigmentation, anti-tumor, antibacterial, cytotoxic, anti-helminthic, allopathic, alopecia, inflammation, leukoderma, eczema, psoriasis, and leprosy. So not only I have given comparison, but I have projected things where somebody can go ahead with something new. And I again thank you the team, and I am ready after 3-4 months to deliver the remaining lecture, because I am planning to prepare.
Thank you so much, sir.
Okay.
Actually, you have given more knowledge within the last 1 hour. Actually, every day for the last 5 years, we are conducting this Zoom meeting. Even though every day we are getting new knowledge.
Yes, definitely.
Every day we are
It
getting
adds to our
many things are
stock.
very new to us. So you have delivered a wonderful lecture. Thank you so much. Come again. We are eagerly waiting for your next session. Now it is Dr. Ram Parvesha. I think he is waiting to say something. We have
Yes.
only 1 minute. You can say vote of thanks to Dr. Patel.
Thank you, Dr. Anni, and congratulations, Dr. R.A. Patel, sir. Very nice, great presentation. Ayurvedic and homeopathic similarity, and lot of medicine, homeopathic, Ayurvedic. So, very thanks, sir. Very nice, excellent presentation, behalf of whole team.
Thank you.
Very thanks. And but Nigella sativa is a very good remedy use of kitchen. Thank you, sir. Thank you.
Thank you so much. Dr. Patel, one thing I wanted to ask you, you have mentioned that the prickly heat is not prickly heat and it is diabetic dermatitis. Is it because of the diabetes or not because of the heat? Are you hearing me? I think you are muted, sir. Please unmute yourself. Patel, sir.
Informed, that's the reason why he may not be able to listen to you.
Okay, no problem. Now we are moving to the Malayalam session. I'm inviting Dr. Mariamma
Yes,
John.
sir.
Have you heard
Sure.
what I asked?
Pardon?
Okay, sir. Okay, now we are finishing the session. Thank you so much. Come again.
Please continue.
Now we are moving to Malayalam
Continue.
session. Thank you, sir. Thank you. Thank you so much. And Dr. Mariamma, you are welcome to moderate the Malayalam session. Thank you.